लोग ये स्कूल है, ये स्कूल है, nothing in the paper में कुछ भी नहीं रहता है ऐसा।
What we can do on that?
So many times
help them by giving the details on India.
कम से कम थोड़ा details देना मुझे डॉक्टर
Excuse me,
का।
I'll just interrupt you here, but I just have something to tell you on this point. That just yesterday at Audiologists National Institute of Hearing Handicapped in Bandra, they had function to say, that they have a website for disability helpline, and there one of my colleagues who had attended just told me that at with that on that website you have a list of all the special services that are there, means list of special schools in Bombay for mentally challenged, for hearing handicap, for hearing impaired. So that list is available. So what you were saying now that we are not having any information as such, that will give you information. So we can give you that information of that website, and through that you can get what all centers are there. And I think your primary concern now is what to do with them at the moment, and like is there some residential accommodation for them is also.
14 years, 15 years हो गया।
I think that is your concern, because you can see your wife is really getting affected by that, and you need to have some kind of a future plan, like having some residential, which is something which is I understand that this need is very genuine, and in India as of now we do not have so many residential facilities for children who have who are cognitively affected and who have do not function as per their age. We have less facilities in terms of residential, I agree. So what we have to do as of now is rather than being very frustrated about what is not there, we have to look for what is there. We have to look for where there are parents who have, and we can give you addresses related to that, where other parents who have children with cognitively impaired children only, and how they have looked after them. Some of them are excellent in music, and I have had some people who come to teach the music, and on the harmonium or whichever it is instrument that the child is Casio or whatever, they are learning beautifully on that, and their mind gets concentrated there, and through that you can help them to settle down and use it for something else. So there are avenues available. Even now it is not as if all hope is lost and you can't do anything. It's not like that. But as Madam said, you have to try to be at one center and try to consistently go for therapy or go for any kind of management programs. You have to stick to that, because if you go to 10 centers and everywhere maybe you have spent a month, but those 10 months are not giving you information as what you require, because everyone is going to do the initial assessments, okay, and in that your 15 days may be lost. So what have you gained? You hardly gained anything. So it is wiser to stick to one or two centers, one center where you feel, I think I can get faith on these people, and then stick there and get the best of help.
There is one school at New Exhibition also, and one at Gloria Church at
Vaikilanza school. It's very good.
That also I tried, but
at what age did you try?
There are some non-government organizations. If you have heard of GODS, they also cater to children who are grown up, like mentally retarded children who are grown up, or other disabled children who are grown up. They give them work according to their abilities. So there are in Powai also we have a center, their center. They have I think 5-6 centers. So I can give you their address and you can contact them.
Why don't you give us your details, so in case if one of us gets the information, we would pass it on.
So that also, just some children they need residential also there, but not, they cannot afford.
Just note down your
right now what I'm trying to do is that separate the children from their mother.
Yeah.
Okay.
So they can do their own work, and mother also don't get so much depressed. Both she's almost all like mad.
On the verge of
she's 15 years child. That also.
I have an example to tell you here without giving names, just to give you hope. Okay. I am working at Nair Hospital, and there is a doctor in Nair Hospital. Presently, I don't know whether she's in Nair or she's been posted elsewhere. This lady has got 2 daughters who are severely mentally retarded. Okay? And for her, one can imagine that being a doctor, you are ready to treat others, but it is very difficult to accept that the same problem can come home also. And this lady has, at one point of time, she has told me that when they were young, to teach them self-help skills, she had to do all activities with them, inclusive of bathing, dressing, sitting, eating, every activity she had to be with them to teach them. And she used to say, I used to make them sit and I used to do those activities. And this lady was pursuing a full-time job at Nair Hospital. She used to go from Chembur or to Nair, that kind of a distance. So against all odds, and every time I've seen that lady only with a smiling face. She had somehow, through God's gift, she had accepted that this is, God has given me these children and they are for me to look after, nobody else is going to do it for me. And that lady just went all out. And I'm not saying today that those children are something, where they may not have reached a capacity that they are school going or they are, they have learned to read and write, maybe, but whatever it is, they are looking after themselves, their self-help skills are, good, and she's brought them to a level where they are able to take care of themselves. They are also now maybe in their 15 to 18 age group. So it is something that there are many parents out in the society who have similar problems to you, and it doesn't matter, the pain is the same. Whether you are which are middle class, upper middle class, low middle class, the pain of the parent is the same, mind you. And there are many other people who can share that with you, help your wife, but come out, meet them, have some, somewhere you have to kind of, deal with whatever your day-to-day problems are and come out and deal with that. And I'm sure there is a lot that can be done for your children even today at this age.
There is one more problem with my wife. Somebody, neighbors have words, udhar leke jao, baba, idhar hai,
That's exactly what I was saying.
And that also
you have to be.
Go to Muslims, if you go to Muslims, they say dargah leke jao, mera baba dargah. And being a Christian, being a Christian, to go to other religion is selfish. Like it's like my mobile number and whatever it is like that. But other people बोलेंगे ना मेरा wife बोलते नहीं उधर लेके जाओ that also my wife has taken a lot of money that we have spent like that also. उसका भी mind ऐसा है, but madam like madam she is a very mature mind.
She's a mother. Try to understand and don't compare the problem.
Not all mothers like that. I'm telling you about my wife.
Your problem is different.
I'm telling you about my wife. We don't have that much. नहीं मेरा बच्चा लोग ऐसा नहीं है. अभी सोसाइटी में जाएगा ना, she doesn't accept it. बोलते नहीं मेरा बच्चा लोग ऐसा नहीं है. मेरा बच्चा लोग ऐसा है.
That's exactly.
That's what I want to separate her from. कभी से सोच रहे हैं हमको इसको बच्चे लोग किधर भी डाल देगा ना, तो सेपरेट करेगा. एटलीस्ट.
लेकिन आप बाहर निकलोगे, आप लोगों से मिलोगे, तो आपका जैसे आपका प्रॉब्लम है ना, जैसे हमारा प्रॉब्लम था, तो हम लोगों को भी और पेरेंट्स लोगों से बातें करके, और पहले तो हम लोगों को भी दुख तो लगता ही है, क्योंकि हम लोगों को ऐसा तो फील होता है क्यों ये मेरे बच्चे में ही आया, लेकिन ऐसे फिर सोचते हैं कि नहीं अभी प्रॉब्लम तो है और इसमें से ही हमको आगे बढ़ना है, तो हम इससे भाग तो नहीं सकेंगे. जैसे आप बोल रहे हैं आपकी वाइफ एक्सेप्ट नहीं करती है और छुपाना चाहती है, कितने दिन छुपाओगे? आपको सोसाइटी में रहना है तो छुपाना तो नहीं चाहिए. और आपको दूसरे पेरेंट्स लोगों से जो हेल्प मिलेगी ना, वो बहुत अच्छा रहेगा. कि जैसे अभी वो डॉक्टर का एग्जांपल दिया, तो ऐसे कुछ लोगों से आप मिलोगे तो आपको ऐसे लगेगा कि आप अकेले नहीं हो, आपके इसमें बहुत और लोग हैं और वो
ज्यादा प्रॉब्लम वाले भी है.
हाँ, और वो क्या क्या कर रहे हैं, तो वो क्या क्या कर रहे हैं, तो आप फेथ रखिए और स्लोली ग्रेजुअली वर्क करिए, तो थोड़ा उनका लेवल तो इम्प्रूव होगा ही.
अभी क्या करना है मैडम? What happened?
Give your details and then they will then decide together as a group of what is the best way to help you out.
Okay.
So that should be the first step, and also I think all of your tips are also very important about how to be part of it and not be accept it and not just living in denial saying that it's all fine. That's I think one very important message.
मेरा वाइफ बिल्कुल एग्री नहीं करती. नहीं मेरे बच्चे लोग ऐसे नहीं, किसी ने कुछ किए गए, कुछ ने क्या किया गया.
It happens.
Can we do a 5-minute refreshment break?
I just let's just address a couple of questions. We can just have it a little later.
Along with it, or
along with it will be fine, right?
Is everybody okay?
Yeah. Sure. So, do you want to now share what you have, your issue, and maybe she can help you or anybody can help you about it?
My first question is that spending is curable.
My I really need help a lot.
See,
I can
basically in the developmental years, okay, every child goes through this period of disfluencies, right? Now, if it persists after some years, then it is remediable in terms of, not cure as such, but it can be brought under control. What we call as the fluency control. And control is all about, all of us have to have some amount of control for, so many issues. Okay, now if I am dieting, I have to get that that control over my diet. Okay, same way for fluency also, if you can achieve that kind of a control through the techniques. Okay, and very important aspect for fluency is, like most authorities in our field, they talk about the ABC of stuttering. That means we have to deal with 3 components. That is the affective. A is the affective, which means the feelings of the individual. B is the behavioral, that means the disfluencies. And C is the cognitive, that means your attitude. Okay. So basically, your attitude should be not negative, and there should be a certain amount of acceptance that yes, I am challenged in this area and I have to accept it. Like how Devin, he's challenged but he has taken it up and he has come out so well. So these 3 areas have to be addressed in a treatment program, more so with the adults. And with the children, these ABCs, if we deal with them and with the parents at a young age, we can really prevent the problem from becoming worse. Or very often the child gets a good fluency control and he's doing well. Like just yesterday, I have seen a boy of 7 years. He had moderate stuttering, and
about 2 years of age, and the child is just starting to form 2-word combinations.
Till 5 years he is speaking very well.
In your case it was different,
after
but
5, 6 years
many a times like even normal children, like who might talk normally later on, they go through this phase of normal disfluency, which is like a 6 months period, I feel, when they are just like learning to talk, and there's so much to express and they are not able to get all those tongue movements together, so they stammer at that age. But then the